learning about what foods can support women during menopause. Naturopathic Dr. Jacqui Fleury joins me with more this morning in Healthy Living. Good morning, Jacqui.
Good morning, Chantel.
And we're looking at different food sources and looking at protein as well. Can dairy be a source of protein?
Dairy is an adequate source of protein. It's actually a concentrated source of protein if you are that person that can digest and tolerate dairy. So I think what's caught my interest lately is there is a lot of information online for quick and easy recipes using Greek yogurt or cottage cheese as a source of protein. But what I've experienced in practice over many years is not every woman can tolerate dairy. So dairy can be a really hard source of protein to digest for some digestive tracts. And it's a very different intolerance than being lactose intolerant. So if you can't digest lactose, you'll know that, like you will have loose stools and you'll feel unwell from consuming lactose. But it's the casein, which is a protein component of dairy. So it's high in cottage cheese and Greek yogurt. And there's a certain population of women and men, but we're here to talk about women in menopause, that when they consume dairy, it doesn't digest properly in their guts. And then you combine that with the increased propensity for leaky gut in women who are transitioning through menopause. So it's a bit of a chicken and the egg scenario, which means that if they're not digesting it, it's inflaming their gut. And if their guts are already a bit inflamed due to hormonal changes, then it just amplifies. But they may not feel it in their gut. They might notice that their skin feels puffy, or that they may be having breakouts that they've never had before, or they just notice their sinuses are congested. So it's these subtle symptoms that they may not directly relate back to the fact that they're eating all these eggs or all this dairy to try and increase their protein.
So what do you recommend if it comes to food sources, or if someone is maybe feeling that discomfort if they're noticing in their digestive tract?
Well, the first thing I would suggest is customize your nutrition to you as well as you can. So you and I did a food sensitivity test together a while back, and that's a simple blood spot test, but it helps you understand whether or not your specific immune system has developed an intolerance or an antibody response. So that's the first thing I would say before we panic and try and eliminate the dairy as a source of protein, because the dairy's not the problem, it's the immune system's response to the dairy. But the other thing that I incorporated many years ago is the philosophy that breakfast is just another meal, because I feel like that's the hardest meal for people to try and figure out what to eat if they're not eating dairy and eggs. So turning breakfast into just another meal, so having a hearty bowl of soup in the morning, especially in the winter months, where you can incorporate bone broth and really make a hearty breakfast that doesn't have the dairy and the eggs. And then there are certain protein powders that have a lower, there's less of a chance that it's going to be irritating to your gut. And ironically, even though a person may be dairy intolerant, they may actually still be able to tolerate whey. So whey powder is a good option. But again, just knowing what your specific body responses are is a really great starting point.
Okay, and just wrapping up, Jacqui, anything else you'd like to add in if someone wants to check in on what is best for them?
Yeah. I think really self-awareness, I think, is the takeaway for this morning. Understanding that there's so much great information online, but that the better you can understand your own body's unique response to the nutrition, I think, is a really great starting point.
Thank you so much, Dr. Jacqui Fleury.
Thanks for having me.